Good afternoon, everyone. David Jordan with the United Methodist Health Ministry Fund. We're going to go ahead and get started. Thank you all for joining us for this exciting webinar, Understanding Kansas Childcare During COVID-19. We have a great panel of presenters today from Childcare Aware and from Kansas Action for Children. The agenda is pretty straightforward today. We'll have some brief welcome and introductions from me. A quick housekeeping note, we have over 2,000 folks on today's call and expect more. Please put your name and organization in the chat so that we can see who's on the call. Also, please use the chat for any thoughts and questions you have throughout the presentation. And we'll take some questions and answers from Kelley and Emily during the end of their conversation, and then we'll have a discussion afterwards. So following my brief remarks, Kelley Davydov, the CEO of Childcare Aware of Kansas, and Emily Kelley from Childcare Aware of Kansas will be presenting the results of a survey of childcare providers across the state that they completed recently in partnership with the Health Fund. Then John Wilson, President and CEO of the Kansas Action for Children, will share his reaction to the report, including recommendations, and also provide some thoughts on how this report aligns with Kansas Action for Children's work in the earlier learning space and their robust children's agenda. We hope to have a robust discussion, answer questions, and talk about challenges and opportunities in the early learning space in Kansas, and also nationally, as there's a lot of discussion about how childcare fits into the Build Back Better plan and the reconciliation process. So with that, I will turn things over to Kelley and Emma and ask them to take it away. Thank you all.
Great, thank you. I think Emma is pulling up our slides. All right. Well, I just want to thank everyone for your time in joining us for this conversation today. This has really been a wonderful partnership with the United Methodist Health Ministry Fund to administer a survey to Kansas childcare providers to really ask some good questions and try to understand how childcare providers are responding to COVID-19, both from a prevention and a mitigation standpoint within their early care and education environments. Emma, if you want to go ahead and advance the slides for me. So the survey that we administered was sent via email to all licensed Kansas childcare providers, which is over 4,000 programs in the state. And we really had a robust response to the survey with 1,258 providers completing the questions. That represents about 28.9% response rate, meaning that the information that we're sharing here is fairly representative of what's happening in Kansas childcare programs. To share a little bit of context around the demographics, as we looked at responses and sort of where they were coming from, we had responses from 102 of Kansas's 105 counties. 57% of the responses were from licensed daycare homes. Just about 28% were from group daycare homes, and about 15% were centers. And if you look at the bar chart just below that, you'll see how our survey responses stack up against the state composition for different childcare program types. So it's fairly well in line with what we see overall, and just a really representative sample. Next, Emma. One of the first questions that we asked childcare providers in this survey is what precautions they are currently taking in their childcare program. And we gave them several different options to choose from, as you can see from the chart on the left. We asked whether or not they were doing all of these different things listed. So everything from disinfecting and cleaning to increased hand washing, temperature temperature taking, symptom screening, modifying parent pickup and drop off. We asked about staff vaccination and whether or not they had any social distancing in place. We asked if they were providing any resources to parents or grouping children into smaller cohorts, reducing the number of children in the program, masking, ventilation, all kinds of different strategies that could be used to both prevent and mitigate COVID-19. And so what we found was overall, 98.6% of Kansas childcare providers are doing something to prevent or mitigate COVID-19. Only 19 of the programs that responded said they were not taking any sort of precautions. So by and large, Kansas childcare providers are working hard to implement strategies for COVID-19 prevention and mitigation. But when we looked at the breakdown of where they were spending their time and effort, or which strategies programs were using, we saw less uptake in some of the public health measures that are currently being recommended and that are sort of proven public health strategies. So masking is less at 26%. Social distancing is another one that is not as highly implemented at 36%. And then vaccination for staff, we'll talk a little bit more about that as well, but that's also not one that is as high as some of the other strategies being employed. So you can see sort of the breakdown in the distribution in terms of which strategies are being implemented there. But I think overall, this highlights some opportunities to talk about where childcare providers could devote their time and attention if they were choosing strategies to implement. Emma, next slide. We also wanted to ask childcare providers about the impacts of the Delta variant on their approach and their strategies. We wondered if this is making a difference in how they are thinking about policies, procedures, precautions that they're taking. And what we found is that the majority, about 63%, reported that the Delta variant really didn't change their approach. Of those that said the Delta variant did change their approach, was about 38%. The vast majority indicated that they had increased precautionary procedures. Some, about 20%, said that they reduced the number of children in their program. And really only 3% reported temporarily closing because of the Delta variant. So by and large, does not seem like the Delta variant has had a significant change or impact on what strategies childcare providers are implementing. For those that did have a change in their approach, most increased the precautionary measures that they were implementing. Next slide. I'm going to hand it over to Emma to talk a little bit about some of the other areas we explored.
Yes, so the next topic that we asked providers about is vaccinations. And we just asked them, are you vaccinated? Out of the respondents from licensed centers, 77% reported being vaccinated. And then out of those from licensed homes, 58% of respondents reported being vaccinated. So because licensed homes often only have one employee, we separated out the responses for vaccines being required or not in their program by centers and homes, as you can see from the graphics that I'm going to show. So this graphic shows that 58% of those in homes required vaccinations or were vaccinated, but 27% reported requiring it. So then the way that we asked about vaccinations in centers is displayed in the graphic I'm going to show. So first we asked if they're vaccinated or not. And then we asked if none, some, or all of their other staff were vaccinated. Very few centers, only 6%, reported that no other staff were vaccinated in their program. From this, we assume that if none or only some other staff were vaccinated, that vaccines were not required, probably. So then we asked from those who reported that all their staff were vaccinated, if that was required in their program. So out of those programs, only 39% of them reported that vaccines were required. So next we wanted to see why respondents weren't vaccinated or why programs weren't requiring vaccines. So the majority of providers reported that it was due to personal beliefs at 64%. Very few reported that it was because of being able to access the vaccine, maybe due to transportation issues or difficulty setting up an appointment. Many providers reported it was for other reasons, and there were some common themes in the other reasons. So many who marked other stated it was because they believe that staff should have the individual choice of whether or not they want to be vaccinated. Some reported it was because of medical reasons, like several were pregnant, or many commented that their doctor recommended that they shouldn't get the vaccine. Some believed that the research and testing on the vaccines isn't strong enough and they weren't ready to get it yet. And some were concerned about the side effects of the vaccine. A couple had said that they previously had the virus and believed that the antibodies were enough and they didn't want to get the vaccine for that reason. And then many reported that higher administration was not requiring it in their programs, such as programs that operate in a church or in a school district. Okay. So as we talked about, there were higher rates of vaccination among providers in centers than in home-based settings. As we know, Kansas is a widely rural state, and in rural areas, families are more spread out, which often means that rather than having large centers that care for more children, there are more small family and group homes spread out across those rural areas to serve children and communities so they don't have to make those longer commutes to get care. This table kind of helps to illustrate this idea. For example, in frontier counties, which are counties with less than 6 residents per square mile, 87% of providers are a family or a group home, and only 10% are centers. And then in urban counties, which is more than 150 residents per square mile, there are less than 2/3 of the amount of family and group homes and twice as many centers in those counties. So this could possibly indicate a health equity issue for children in rural communities. This is kind of something that we were looking at because vaccinations are more common in childcare centers. Children in rural areas that are primarily served by family and group homes could be more likely to be cared for by unvaccinated providers, increasing their likelihood of being exposed to the virus. So next, we asked respondents about procedures for what happens when someone in their program gets COVID, whether it's a child or a staff member, and if they require testing and when they require testing. So for exposure, 83% of respondents reported that they require children to be quarantined when they're exposed to the virus. 79% said that they notify the local health department. 74% require staff to be quarantined, and 54% say that they test their staff when they're exposed to the virus. As far as testing, when staff are tested, 95% of centers and 94% of homes said they require their staff to wait at home for the results before returning to work. Only 4% require testing as a regular precaution in their program. And then 35% of programs indicated that they don't require any testing at all, neither as a precaution or when they're exposed. So as Kelley kind of discussed, most providers are taking extra precautions, but some of the recommended public health measures like masking and social distancing are not as common. So we wanted to know, we asked providers what they would need or what would help them to implement more precautions. The most common response was that providers needed more financial support. This was a pretty common theme in the qualitative part of the survey. Almost half said that they need more support from parents in the community, which I'll kind of touch on a little bit later. And many reported having mandates from the state or requirements would push them to increase their precautions as well. Still, 29% said they didn't want to make any more changes. And the most common reason for this was that providers feel like they're already doing enough. It's exhausting, it takes up a lot of their time, and they were a little bit confused at what else they could do other than what they're already doing. And another common reason was that providers often face pushback and conflict from parents about policies like mask wearing, more strict symptom screening, and then keeping children home when they are displaying any symptoms of COVID. So we have some quotes. Whoops. So the first quote is from a provider that thinks state mandates would help encourage parents to support and follow new guidelines. This provider said, if mandates were put in place, I feel it would be easier to have support from parents. The second quote illustrates the financial strain and the staffing issues that providers are having, and then conflict with parents. This provider said, yes, we have already increased our precautions, but we would be able to do more if we had more funding to keep extra staff in place for even more extra cleaning. Also, it may help us with the pushback we receive from parents when we try to implement increased precautions. And then the last quote is similar to several others from providers that feel like they've done enough, and they're a little bit skeptical about receiving the vaccine as well. This provider said, I feel I'm doing all I can, and I don't want to get the vaccine until there's been a long while of seeing what side effects come from it. So end of the survey, we kind of wanted to see a more broad picture of how the pandemic impacted providers overall. So we asked some open-ended questions about the barriers that providers have faced and what they need moving forward to recover and to continue to provide quality care to children. So there were some common themes in the responses to these questions. So as for the biggest barriers, one of the biggest themes was staffing. Providers often talked about issues hiring and retaining reliable staff. So not just getting staff to work for them. Many reported that it was hard to attract new employees because they lack the funds to pay them. And then also many stated that they have trouble with staff not showing up to work due to COVID or other reasons. Another common theme was that providers discussed strained relationships with families, kind of like how I mentioned earlier, in their programs and in the community. A lot of providers have experienced conflict with their families and want to be recognized and supported through this difficult time because they're making really difficult choices that impact children and families and themselves. Providers also talked about financial strain from closures and reducing, like many reduced the number of children in their program. So their income was going down, and then cost of implementing precautions often can be a difficulty for programs. So this kind of ties into stress and burnout. The financial strain often caused stress and burnout for providers, and some even reported, considering getting a new career path and closing their programs because of the high cost and the seemingly low reward. So moving forward, providers reported several key things that they need. The first one was financial support. Like I mentioned earlier, this was a pretty common theme. The pandemic just put a huge strain on providers, and many are still recovering from that. Another common theme was clear information about the pandemic and about what they can do to protect themselves and children and families in their program. They expressed wanting to be able to communicate with the families about more concrete guidelines and rules and policies that can encourage parents to be on the same page as them. And then community support, this kind of ties in to the clear information with parents and communication, but community support and recognition was also something that many providers mentioned. They expressed feeling undervalued and underappreciated during the pandemic. And these first two quotes kind of help to illustrate that. The first one says, my hope is that now childcare is recognized as an essential part of the American economy, and there will be financial help in the near future. And the second one says, support and recognition that if we were not here daily for all parents, they would not be able to do their job. Teachers are daily hailed as heroes, but childcare is just expected. I feel as we've been kicked to the ground. So similar to financial support and community recognition, providers also feel that childcare workers should receive higher pay. Like I mentioned earlier, it's harder for them to attract new workers and to stay in the field because they're just not making enough. And they believe that their jobs are valuable and they should be adequately compensated for their efforts. And it has to do with staffing. So the final three quotes kind of help to illustrate those points as well. They say, it's hard to hire new staff at a low wage. One provider said they need community and parent support for new regulations, and then clear and decisive information that can be passed along to our parents. Okay, so that's all I have for you. And now we're going to open it up for discussion. And here's Kelley and I's contact information as well.
Excellent. Thank you so much, Kelly and Emma. Great presentation and a lot of data and also very digestible quotes. Do folks have questions on the findings of the survey? Well, I'll start things off then. Kelly or Emma, I know that you are also partnering with the team at the state level to try to provide some resources to centers to help deal with COVID mitigation efforts. And that's been a lot of information sharing, but also resource sharing. Given that you've made that big push, were you surprised by any of the results in terms of maybe the lack of awareness of some clear public health mitigation and some of the other responses that you got?
That's a great question. I think you're absolutely right. We have been working with state partners to provide resources and support to childcare providers throughout the pandemic. And particularly recently, we've launched a couple of grant opportunities in partnership with the Department for Children and Families and the Kansas Department of Health and Environment. We also have childcare health consultants that are available to work directly with childcare programs. And they're focusing not only on COVID-19 strategies, but broadly on health and safety as well. So to some degree, I'm not all that surprised by the results. We certainly have not been able to connect with and provide one-to-one support to every childcare provider, all of the 4,000 programs that are in our state yet. We're continuing to work on serving them in that capacity. But I think, overall, childcare providers are busy and they're busy caring for children. And that's where a lot of their focus and time and attention goes, as it should. And so the additional support that we're trying to layer on top of that, I think it's important to recognize that that's an add-on to their day in many, many ways. And it's a stressful time for childcare providers. I think they want to do good work. They want to provide good care for young children. They want to work positively with families and communities, but we are asking a lot. We're asking them in many cases to accept young children into their home in the midst of a pandemic. That means increased exposure for their own families. So to some degree, no, I'm not surprised necessarily by the response. I think we're, as a system of early care and education, we have, really good things in place, and we're working to support childcare providers. But of course, there's always more work that we can be doing.
Thank you. That's great. I see a question from Rich Minder. Did we collect racial and ethnic data? And if so, did we see any patterns based on these? And I also think there's probably something to unpack around geographic data. So I don't know if Emma or Kelly wants to take that.
Emma, do you want to clarify on that piece?
Yes, for this survey, we did not collect racial and ethnic data. And Kelly, I guess you can kind of expand on the rest of that.
So we did ask about geography. This was an anonymous survey. We did not ask about the race and ethnicity. This was targeted to childcare program directors. So of course, there's a layer of staff respondents within programs that we didn't connect with for this survey purpose. But I think, part of what we know overall about the early care and education workforce in Kansas is that providers of color are underrepresented in this field. And that's based on our last workforce study completed in 2018, and is a huge part of the conversation. So I appreciate that issue being flagged and raised as part of the conversation.
Thanks. Any other questions from folks? You can use the chat or just raise it through traditional means, turning on your microphone. I guess I'll ask one more question and hopefully folks can, before pivoting to John, based off of childcare aware data in the past, we know that all but 3 counties were lacking adequate childcare based off of population and need. How do you see the pandemic impacting both access now and also the potential for the future? Because it really, I mean, we are putting a lot of stress, as you saw in those quotes, on childcare providers, both from a public health mitigation standpoint, a COVID mitigation standpoint, but there's also other layers on there just about affordability. And then we haven't even gotten to the quality question.
That was a great question, and I will do my best to untangle all of these intertwined considerations for that. First of all, in terms of the supply of childcare, the most recent numbers that I have looked at, we compared the number of childcare programs open and operating licensed childcare programs in 2019 through August of 2021, which covers kind of the pre-pandemic to current date, if you will. And we've lost over 300 licensed childcare programs. The vast majority of those are within family childcare. So licensed, family childcare, group childcare, not center-based care. We've actually seen a slight increase in that. We've added childcare center programs. We have lost a large chunk of family childcare. I would expect, however, that while the pandemic has had an impact on that trend is in keeping with trends we were seeing before the pandemic. Kansas has seen a steady decline in the supply of childcare even before the pandemic hit. The pandemic has probably highlighted and perhaps accelerated the loss of some of those childcare programs. But there's a few pieces that I think are compounding factors. And one is the demographics of our workforce. We have an aging childcare workforce, if you will. Our last workforce study showed that 45% of our family childcare providers are over the age of 50, and that was done in 2018. So that has continued. And I don't know that we have a good sense on whether or not we've been able to recruit new providers into the field, but given the overall decline in number of programs, I'm guessing not. So that continued trend of childcare providers perhaps leaving because of the pandemic, also perhaps leaving because of retirement. The great retirement is actually was highlighted at a conference I was at yesterday, and that is impacting kind of our labor pool across the state, and childcare is no different. So I think that's a piece that we have to keep on the radar for the future. Affordability is certainly a consideration on the family side, but it's also a consideration on the childcare provider side. They're operating in many cases a small business, and the cost of providing care and the cost of providing quality care continues to increase, but their ability to pass that cost on to families is certainly limited. And we don't necessarily want to pass that cost off to families who cannot afford to pay a larger share of their income for high quality childcare. So I think, access and high quality care both go hand in hand, and there are many intertwined considerations that impact that. And I think the pandemic has highlighted some fault lines in our early care and education system that existed before the pandemic, and certainly accelerated some of the strain that we're feeling. So I think I answered your question. If I missed any parts, David, just let me know.
I think you did a great job. And to me, at the United Methodist Health Industry Fund, one of our strategic areas of funding is early childhood development. And we know how important it is to support families, young children, and their caregivers in the critical prenatal to 5 period of their life, because it's really going to make an impact on their health for their long term, their learning, their school readiness, the success that they have in school, and then their economic status. So it's critical that every Kansas kid has access to high quality, affordable childcare. And we know that, as you really did a good job outlining, that was a challenge pre-pandemic, and this research really highlighted the strain that the pandemic has put on childcare providers. I think there's both the short term, how can we help get resources to childcare providers to make sure that we can put public health measures in place. I think one of the challenges is, as a parent with two children in childcare, is we don't want the choice to be whether or not there's childcare, and that's what we're living with, but that they have options of childcare with safety, whether or not that's safety with safe staffing, as a result of things like Lexi's Law that Childcare Aware worked on, or that they're using public health best practices to mitigate the spread of COVID. And I know that's a challenge in communities, and it's a challenge particularly in our rural communities and even in places like Hutchinson. We also know that inequities existed in communities of color and low-income Kansans were most impacted by COVID. But there is this long-term need to both address equity and affordability and shore up the system. I mean, from a system standpoint, Kansas doesn't draw down nearly as many federal funds as other states. We're 47th out of the 50 states in drawing down federal funds. And then in terms of the early childhood sector, we're 48th out of the 50 states in aligning those resources and having the most streamlined system to maximize federal dollars. So there's need to work on policy. Thankfully, we have great policy partners and great childcare providers that I think have their eye towards the system. So I want to turn things over to John Wilson, the president and CEO of Kansas Action for Children, who I know is both a former policymaker, a dad with young children, and also an advocate working on these issues to share his reaction and to really to keep this dialogue going, because I think we all need to be working together, because I think everyone's intentions is in the same place. Is how can every Kansas kid have a strong start? How can the child care sector be strong and robust? And how can we partner to make Kansas the best place to raise a kid? So John, I'll turn it over to you.
Thanks, David. I appreciate the opportunity to be a part of this presentation, and really want to thank Kelley and Emma and the Childcare Aware folks for conducting the survey and thoughtfully analyzing it. And of course, David, you and your team for providing the funding to do that. We know that with really quality data, we can make smarter decisions at every level of government and in all types of policies. So I really appreciate your leadership on that. For those of you all who are less familiar with Kansas Action for Children, we are a nonprofit advocacy organization working to make Kansas a place where every child has the opportunity to grow up healthy and to thrive. We work across the political spectrum to improve the lives of Kansas children through bipartisan advocacy, partnership, and information sharing on key issues like early learning, health, economic security, and even state fiscal policy. We work with policymakers, we work with local organizations and fellow advocates to inform sound policy, to encourage collaboration, and to promote equity throughout our systems that shape our lives. And I think most importantly, we believe that every child has the opportunity to thrive, should have the opportunity to thrive regardless of their race, income, zip code, identity, or ability, because that's what's going to help position our state for future success. I feel a little inadequate in a lot of ways being a person to respond to this, because I look at the list of people on this call and realize there are so many people that have expertise through their profession, through their lived experience, who could respond really thoughtfully to what was shared with us. So recognizing I feel a little inadequate in comparison to the rest of the room, I'm gonna touch on a couple of things. First thing is that where would we be without the work of the child care resource and referral agencies in Kansas and groups like the Kansas Association for the Education of Young Children and the Child Care Providers Coalition, who are equipping and strengthening the child care workforce in Kansas in collaboration with state agencies. In particular, I'm thinking of the Family Conservancy and Child Start and Child Care Aware of Eastern Kansas and Child Care Aware of Kansas, and their ability to build trust with these providers. And I think about the monumental task of trying to connect with 4,000 licensed providers in Kansas. Kelley, you and your colleagues, I think, play an integral part in the advocacy ecosystem in Kansas for strengthening childcare. So that's the first thing that I wanted to acknowledge. The second thing is I want to acknowledge, like David mentioned, I'm a father of two small children. My eldest is now in elementary school, but I have a 5-year-old who's in a child care center here in Lawrence, where I live. And we have been experiencing a lot of the things that this report highlighted as a family. You know, I've been sitting here in my basement closet since March of 2020. And at that time, having to have made the decision to pull both children out of childcare and school. And it wasn't until earlier this fall that my 5-year-old went back to childcare, and we had to work very hard, even in Lawrence, to find childcare that met our expectations, that was both high quality and also practice many of the safety measures that were identified in this report. So I'm thankful that finally we've landed on that. But my goodness, how stressful was that for my family, for me as an employer, to who's supporting employees. So so I'm just speaking from a place of personal experience on this. So it would be easy, and I think it can sometimes become a custom in Kansas childcare policy advocacy space to dwell on the challenges that face this sector of our economy. That how daunting it is to address provider pay, how daunting it is to address quality, how daunting it is to ensure that this critical infrastructure has the investments it needs. So I don't want to dwell on those challenges, because from where I sit, I see so many things heading in the right direction in Kansas, but they won't be headed in that direction without sustained effort and intentionality from folks on this call and folks who aren't able to join this call. We see huge work being done on systems alignment and improvement, the stuff that doesn't require lawmakers to mess it up, where it's about agencies collaborating with each other. It's about examining things that have been tradition and saying, is that necessary, and can we change things? So there's tremendous systems work happening to strengthen the child care profession and to strengthen quality. And there's also momentum in the state legislature, where there is a bipartisan, bicameral early learning caucus where lawmakers are either learning about early childhood development and childcare, or they are invited to learn more about it so that they can become champions for the cause. And KAC and our partners are supporting that early childhood caucus. And then we have lawmakers who have had fairly in-depth experience understanding childcare and early learning and early childhood development, and are positioning themselves to be stronger advocates with their colleagues. And there are opportunities ahead of us in the 22 legislative session to provide additional funding support to strengthen early childhood, and also build awareness about the challenges that still exist. And then at the federal level, there is momentum around childcare. If you're not the same level of policy wonk like Kelley and David and I are, you might not be aware that the lawmakers are debating the Build Back Better Act, which has the potential to provide right now $450 billion to fund childcare. And of course, Kansas would receive a good chunk of that funding, and after full implementation could mean around 88,000 more Kansas children accessing high quality, affordable childcare. So that we are at a moment right now where all eyes are on childcare, but I still think it's a very precarious moment, because there are forces out there that are seeking to politicize an issue that shouldn't be politicized and hasn't been politicized for decades. There is an ideology of distrust with the government and a belief that increased funding in this area is not something that is a priority. And just to be totally candid, most of our federal delegation right now is opposing the funding that I just talked about that could be a game changer for early childhood in Kansas, and that's a problem. So that's the work that KAC is engaging in right now, is through our own work and through work with partners, trying to help those in power understand how their votes and their voice can make a real difference on this. David, I see you coming off mute. Would you like to say something?
Oh, nope, I keep going.
Yeah, great. So I could go a lot of places. I remember in one of the slides you had, Kelley and Emma, that support from parents and community was one of those things that the providers really wanted to see. And I know that's specifically in the context of COVID-19. And but I would imagine that's the same thing they need from a lot of things. we need to provide the support for providers so that they can get health insurance through things like Medicaid expansion that still hasn't happened after 8+ years in Kansas. That could be a game changer for providers. We need to support providers who so that they live in communities where their public health infrastructure has the funding it needs to make sure that that kids and their parents are living in safe communities. There are so many ways that providers need our support, and so that particular thing just resonated with me. And the other thing I was thinking about is Kelley highlighted the kind of what the child care provider's day looks like and how little extra time there is to do some of these things, which I think speaks to why it's incumbent upon all of us to walk alongside and support providers using our ability to speak up and speak out. That's why I'm so thankful to have advocacy colleagues who can share that work. I think back to my son's first child care provider, a family child care provider who just retired after 35 years. She was not with children, focused intently on children from 7:30 in the morning until 5:45 at night. So to think about whether or not she had extra time for an application, even if it was a simple one-page application, or to call a lawmaker or to attend a workshop to learn more about why advocacy is important, very limited time to do that. And I know that's just one experience that represents a lot of people's experience. So I feel like I need to land my plane of seemingly disconnected thoughts. So I'll just say this, that childcare as an issue is interconnected with so many other issues impacting our state. The things that kids and their parents and caregivers need are interconnected. I like to think of it as a recipe and not a menu. You need every ingredient of a recipe for it to be successful. Children need high quality, affordable childcare where the people caring for them are paid livable wages. They need access to affordable health care. The people that care for children need access to affordable health care. We need strong households where there is economic security and there's not a risk of not putting food on the table or paying for rent or paying the utilities. When we don't invest in all of these areas, then frankly, we are undercutting any investments we make in childcare. So if you've come to this call today as somebody who just thinks about childcare, I'm going to invite you to broaden your lens and think about all of these issues as being relevant to childcare, and ask that you join with KAC and our partners in being a voice for health, for economic security, for responsible budget and tax policy to fund these things. All of it, because it is a recipe and not a menu. And KAC has soft launched our Kansas Children's Agenda as a way to bring organizations to this fight, frankly, and to communicate with each other so we know the right time to raise our voices, to inform lawmakers, and to ultimately move the needle on policies that are being stalled by partisan bickering right now. So I'm going to leave it at that.
Excellent. Thanks, John. And I think we want to have a bit of a discussion about this. I mean, I couldn't agree more with a lot of John's sentiments. One, there's a lot of expertise on this call, so I hope folks speak up and add questions or comments, or if there's future discussions you want to have about childcare or safety net issues, let us know. I think we want to try to be a resource and convene folks. John had touched on sort of the tax policy piece, and I think that's a huge piece in terms of how we're financing and using state general fund dollars, but using other dollars like federal dollars. We've been presenting a lot on rural health at the Health Fund, and we've been using a couple of slides that show in 1993, we were 9th in the country in our health rankings as from a population health standpoint, taking in job creation and other public health measures, access. At the time we were about 20th in bringing federal dollars back. Today we're 48th, as I mentioned, 47th, as I mentioned earlier, and we've fallen more than any other state over the last 30 years. So we haven't been investing in this infrastructure, and we've been solely depending on state general fund dollars. And it's put different providers and sectors at risk. And I raise that because we know that childcare is critical to economic development and critical to both the health sector and the education sector. And Deb Bruner, who's a great rural hospital CEO in Mineola, had just highlighted that in the chat, and I'd love to get John and Kelley's reactions and others too, that there's a struggle about funding childcare locally. And I just will make a side note is we can't fund it locally. We can't do this one community at a time because it's not sustainable. That's why we need to change these state policies. And there's not the interest in fully funding childcare in a place like Mineola, but as a result, they're losing school employees. And I know that many hospitals struggle with recruiting childcare providers because of the regulations that go with starting centers, but also even if you build it in places like Phillipsburg with philanthropic dollars, it's tough to continue to operate it. So I think that's why some of these policy issues and funding issues are so critical. So, so to Kelley or John or Emma or others, just reading Deb's comment, any reaction to that?
Well, maybe I'll offer just a couple of thoughts. You know, I think one positive note is communities that are working on the childcare conversation. I think that's a strength that we have to inform anything that's happening at the systemic level. I see it as a win for all of us that communities are coming together and saying, this is a real challenge, and how can we address this? You know, I do think that there are a lot of pieces of the childcare system infrastructure that have to be tackled systemically. You know, we can't address market failures at the local level. Things like, you know, wages and you know, salary supplements are economic market failures that we've got to think about on the systemic level. But I think there's room for communities to generate solutions, to test things out, to especially to shape what things look like from a local perspective. There's you know, a lot to be said for community voice and for family voice in shaping and molding, you know, what approaches look like. And every community is a little bit different too, and has different needs. And you know, you're exactly right. You know, a center isn't going to work in every single community. So having room for that as well, I think, is important too. So go ahead, John, if you've got a reaction to share.
I don't have much to add. I would just say that, I mean, this is I agree. I love seeing the locally driven solutions, and I also am. I think it's unfair to put that much burden on a local system, and so that's why we're trying to, I think, create opportunities for ground up and top down, and I think at a minimum, where these locally driven solutions are taking place, that means that I think they are shovel ready for funding from the federal government, or maybe someday increase state investments from the general fund. So I think you're right. It is absolutely necessary. The one thing I'd add, I recently attended a town hall with Senator Marshall, one of our two senators from Kansas, and I asked specifically about childcare and what he's going to do to support increased to address the affordability issue and pay. And one thing I noticed that I want us all to be aware of as we hear responses to these questions is his concern for government schools. There's going to be a government childcare, government preschools. And I think we need to continue to educate those in power to understand that our mixed delivery system of nonprofit, for-profit, in-home, center-based care is Kansas's solution. What we need is the funding to support it. And so I think it's really important that when we hear those things, we have to like push back on that. So yeah, that's that.
Well, I think those are both helpful comments, and I appreciate you both touching on there is a really critical role for local communities to play, but it's challenging to expect them to do it on their own. And I think that's how can we do it together and provide some support so that they're not on their own. So I appreciate that emphasis from both of you. And I think Rich Minder also had a good comment in the chat. And I think there's a couple of things that we could probably unpack with this. And Rich raised the issue, sort of given the high price, the cost of delivering infant care, it's a time to put more of an emphasis on paid leave. And I almost think you could take this into two different places. One is just the importance of paid leave. But then the truth is there are the economic issues around offering infant care. And if some centers are only providing care beyond infant care, the pressure it puts on some of those centers that aren't providing infant care. So I think there's probably a couple issues to unpack there. So John or Kelley, do you want to jump in?
Sure. I never know which one of us is going to go first. I think maybe I'll speak to the infant care piece first. And then John, perhaps you can add to that, or sorry, I had to chuckle. You can speak to the paid leave piece. Infant and toddler care is really, really critical, and probably the part of the childcare system that is most stressed. It is hardest to find a slot for an infant or toddler in the state of Kansas. And there are, reasons for that. It is more intensive to provide care for a young child, as it should be. We really want high quality, safe, healthy, nurturing care for the youngest, most vulnerable children. So, that does present a challenge, but I think, going back to John's comment about some of the opportunities coming down the pipeline from national, federal level investments, for example, the Build Better Act, if there are opportunities to offset the cost of providing high quality care for infants and toddlers, I think that should be on the table for Kansas's early childhood system, so that it isn't a choice between, am I going to be in the red or the black this month in terms of my business operations? If I'm a childcare provider operating my own business, what's my break-even point in terms of being able to provide care for really young infants and toddlers, or to older children, and how do I make that work in my operations? So if we have an opportunity, I think, with some of those federal investments to think about how to not make that part of the equation for childcare providers, it would be well worth our time to consider that. So I'll stop there, and John, let you go.
Yeah, and I'm going to be brief about it. I think the paid leave components of the Build Back Better Act are a really solid step forward, and we've kind of been at a crossroads of the past few years. Should our efforts in the advocacy community get behind a state level paid leave policy, or should we get behind a federal paid leave policy? And it looks like the most immediate opportunity is at the federal level. And I think one of the challenges, whether it's paid leave or childcare, that we face in Kansas, sorry, I get to always bring it back to the legislature because that's what I know the best, is our legislature. I think for many of the people who are in power, it's been a while since they've had kids in childcare or since they have had small children. And I think we are dealing with some adaptive challenges, if you're familiar with that language, where it takes convincing people that things don't have to be the way that they've always been. And also the economy and expectations for households have changed since when many of the people voting down these things were parents of small children. And so that's why I think more globally, representation matters in the people making decisions in Topeka and in DC.
Very well said. Any other questions that folks have from the audience? Okay, well, thanks for joining us. Kelley and Emma, thanks for the great presentation. John, thanks for the very helpful analysis. And thanks for the great questions, and to everyone who attended. We will be sending out a recording of this to everyone who attended. And if there's any questions that you have after the webinar, or any items that you'd like to see covered in future webinars in the early childhood space, let us know. And if there's any action that we should share, John, on the children's agenda, do you want to flag anything now on that front in terms of actions folks could take?
Yeah, I was going to type that in the chat box. You can just email me, john@kac.org, if you're interested in learning more about the children's agenda.
Great. Thanks, John. Thanks, John. Thanks, Kelley. Thanks, Emma. And thank all of you. Everyone have a great weekend, and we'll talk to you soon. Take care.